Hello, everyone. I'm Lori Sweeney, Regional Director at the Providence Foundations of Oregon. Thank you for joining us today. Today's presentation, Better Outcomes Through Bridges, Finding Answers in Desperate Situations, is part of a virtual speaker series called Doc Talks. These presentations bring our best and brightest clinicians to you so you can learn about how revolutionary treatments, research, and community support, fueled by philanthropy, are bringing hope to more patients throughout Oregon. I am honored today to introduce the director of BOB, Better Outcomes Through Bridges, which we refer to as BOB, Becky Wilkinson. And I know that you will see, as I do, that she has a heart for this work. She lives the Providence Foundation the Providence mission every day, and her heart is really in this work. She also is just a very qualified clinician, and I want to tell you a little bit more about her background. Becky is a lifelong humanitarian and passionate advocate for social justice and human rights. Becky earned her master's degree in social work from Portland State University and is a licensed clinical social worker in the state of Oregon. She has worked for the past 12 years in community outreach within the hospital system. Becky's work honors individual strengths while recognizing the impact of social determinants of health, which you'll learn more about today. And she takes a holistic approach to meeting community needs through various partnerships and has a profound faith in the power of communities to heal. Becky, thank you for joining us, and we look forward to hearing what you have to share.
Thank you so much. I am so excited to share with everyone more about the BOB program. But before I begin, I want to introduce you to someone named Angela. Many years ago, one night in the ER, I was referred to meet with someone named Angela. She had been into the ER for about the 5th time that week. She was coming in because of liver failure due to years of alcohol and drug use. And she was trying to come in to get relief from that liver failure. Her abdomen was swelling profusely, so she had to get it drained on a regular basis just in order to function. I knew that she was living outside and that she was in an abusive relationship. She'd been referred to me in the past, but like many people living outside, she moved around a lot. So I wasn't really able to meet with her until this day. But I found out that she was dying. The ER doctor told me that at this point, all they could do for her was to keep her comfortable. But she was refusing to be admitted into the hospital. So I decided to meet with Angela. I went into her ER room and I introduced myself, my reason for being there. And I just listened to her. I listened to her tell me about years of trauma and abuse, about growing up in the foster care system, sexual abuse, physical abuse. She even mentioned to me memories of being locked in a doghouse outside overnight when she was just 5 years old. And she also shared her attempts at trying to block out these memories by using alcohol and drugs. But I would say her biggest regret was that she was estranged from her own kids and her grandchild. And as I listened to her, it occurred to me that really what I was hearing was fear. She was afraid of people, she was afraid of dying, and she was really afraid of dying alone. So I promised her that I would stay by her side as she agreed to be admitted into the hospital that night. And I spent as much time with her as I could over the next few days, and even as she was transferred into hospice care. I was able to convince her son and grandson to come and see her, but sadly, just a few days after we originally met, she passed away. And I mention Angela's story because this short relationship I had with her had a profound impact on me and how I would do this work for many years to come. And really, as you will find out, how I built the foundation of the BOB program. Everything we do is with folks like Angela in mind. I wish, her story was a rarity, but there are many Angelas out there. Many folks that have trauma, abuse histories, are struggling with substance use disorders, mental health, and folks that are alone. But the good thing is that this is exactly where the Bob program can fill in the gaps. We're able to work with folks that live outside, that have multiple challenges in connecting to care, and that just need support. Thank you again so much for having me. I'm really looking forward to sharing more about Bob with you. So, as Lori mentioned, a lot of what the Bob program focuses on are connecting folks to social determinants of health. And one of the ways we do that is we have the ability to work with folks after they leave the hospital. So the Bob program started off as emergency department outreach, like I mentioned in Angela's story, but we have evolved over the years to 8 different programs at this point. We are focused on community outreach. We have an entire team of peer support specialists, folks that have similar experiences to Angela, but were able to turn things around, that are in recovery. They've gotten state certified to use their own lived experience to help others. But I would say the uniqueness of our work is not only that we have a team of folks with lived experience, and that we're able to do work in the community, but we're able to create really creative community connections. And a lot of what we see are what we call social determinants of health. Next slide. Thank you. What are social determinants of health? Really, what social determinants of health are what impacts health is where you live. So if you live outside and you don't have access to clean water, food, healthcare, substance use treatment, if you're not in a safe situation, if you have a trauma history like Angela, all of these things affect how healthy you are. And so when we say health outcomes, we mean really longevity of life, quality of life. We know that folks that live outside have a much shorter lifespan than folks that have a safe, warm home. I put in here some statistics that studies show around 60 years old is the average life expectancy for someone living outside. But I also read that that number could be as low as 42 to 52 for some folks in select cities. Angela was 52 when she passed away. But we know 85% of our health is social determinants of health. And our team is really lucky that when we get donations, we get special grants, we are able to use those funds to do street outreach. So I put a picture here of what that looks like. So our team gets together, gets all these supplies. Sometimes it's food, clothing, other time it's, hygiene, anything that folks need, anything that we get donated, we bring out into various camps all over the area. The Bob program started in just the Portland metro area, but we have been able to expand all over Oregon and really reach not only metro areas, but really rural areas. So I'm going to talk a little bit more about some of the social determinants of health and how different aspects of our program are able to sort of meet those needs as much as we can. So we look at food insecurity and we look at Oregon. About 1 million people in Oregon do not have enough food to eat. That's 25% of the population, way below the national average. And again, with grants and some philanthropy, we are able to use funds or donated items to bring meals, whether it's warm meals, non-perishables, to different community events. We have community partners all over the state that we co-locate services with, meaning if somebody has a shower event where they're setting up, a mobile shower, if they're giving out supplies, we will work with them to bring additional supplies like food. We'll set up a booth. Each member of our team is able to sign folks up for the Oregon Health Plan. So we can help folks sign up for that. But the point is that yes, we are a Providence program and we focus on Providence patients, but we also serve the entire community to some degree. We recognize that this issue of food insecurity, social determinants of health affects everyone. It affects the entire community. And so we try to do our part to serve as much as we can. Mental health. So mental health in Oregon, unfortunately, we have the highest or second highest rate of mental illness in the state. Look at teens or 12 years and older, any mental illness diagnosis, we're at second. Unfortunately, for access, 59% of people who needed mental health treatment did not receive it in Oregon. And while we are not a team that is made up of clinicians, our team is able to help sort of fill in some of the gaps for folks that need mental health care. We have several different programs that I listed over on the right, where we specifically work with folks with mental health issues. So we have our emergency department outreach and peer program, which I mentioned. That's the work I was doing when I met with Angela. We have a caring contacts program that consists of all peer support specialists who have their own mental health challenges that are providing follow-up calls for folks after they leave the hospital. So every person that comes into one of our Providence hospitals that originally presented in crisis, our team will follow up with them via telephone within 48 hours of discharge. So they're able to use their own unique experience in having mental health issues to help others connect to services. And our main goal for that is to make sure that folks do not have any barriers to follow-up care. We have clinic outreach through behavioral health clinics. We work with folks that really need that extra care. So if a behavioral health clinician feels like somebody really needs support or really needs someone to sit with them in the waiting room because they're very anxious and maybe they're leaving before they even see the doctor, those are things that some of our team can help with. And lastly, we have this new program for inpatient behavioral health. So we've got a peer support team that is working specifically with folks who are discharging. So folks that are getting ready to discharge from one of our psychiatric units, if they are not connected to care, maybe they don't have a provider to follow up with, or if they have a provider and for whatever reason they haven't seen that provider in quite a while, our team will help connect them once they leave. It's a really short intervention. It's really only meant to be a few weeks long for us to be able to make sure they get to that first follow-up and any other support they need. And if they need longer term support, our team will connect them to either a different Bob program, if it's applicable, or some of our community partners. Substance use. We know, all of you know, I'm very sure that substance use is a huge issue in not only this nation, but the state. So for teens and adults in Oregon, we are top in the nation for folks that have illicit drug use disorders, and we are 50th in access. So these are folks, again, that are needing but not receiving treatment. One of the programs that the Bob program really recently partnered up on is called MARS, Multidisciplinary Approach to Addiction Recovery Support. And what that is, it consists of peer support specialists who are in recovery, working with our infectious disease department, connecting with folks who are admitted into the hospital with systemic infections. So for instance, maybe they have a dirty injection site, they need to come into the hospital and get IV antibiotics. Typically, that's a 4 to 6 week admission. So the idea is that our team, along with an entire multidisciplinary team, will meet with the patient. Peer support specifically will provide that connection, that relationship, trusting relationship, and work with them after discharge. The idea is that they will get discharged earlier than the 4 to 6 weeks on a heavy duty IV antibiotic. And this program started in 2020 of all years. And we worked on a pilot for about 9 months, and our peer only provided part-time peer support for this program. It was a cohort of 30 patients. And for those 30 patients in 9 months, we saved about 650 hospital days. So when we think of that, and we think about the time that this program started, right, in the height of COVID, and how invaluable were those hospital beds. So not only were we able to help folks get connected to care, help them on their path to recovery, attending AA meetings with them, making sure they made their follow-up appointments, but we were also able to help the system in a really difficult time. So we have been lucky enough to be able to expand this program a little bit, and we have 2 full-time peers dedicated to this work. In housing, it's no surprise to anyone, housing is a huge issue, again, in this nation and the state. So in Oregon, there are about 15,000 people that are homeless. And I will say over a third of those are in the Portland area. I wanted to point out the reason I added this information on the bottom around the U.S. Housing and Urban Development homeless count for children, and then comparing it to the Department of Education homeless count. So these are 2 different methods for counting folks that are homeless. So HUD has a point in time count, which I'm sure some of you have heard about, and it's 1 night a year where all the folks that are homeless are counted. I will say, I do not believe that this is probably the most accurate picture of who's homeless, but this is what we have for now. And I wanted to compare it to what the Oregon Department of Education is saying, because as you can see, there is a huge discrepancy. So HUD says we have about 2,500 homeless children, and the Department of Education estimates that number to be 22,000. So it could be that we have well over 15,000 homeless folks in Oregon. And, you know, we're not solving homelessness. The Bob program is not solving homelessness, but we're doing our part. We, again, are able to leverage community partnerships to have what we call safe overnight shelters. So various tiny home villages in the area, actually a couple different counties in Oregon we partner with, where we have dedicated tiny homes. We call them Bob bungalows for our patients to use. So folks that are exiting out of the hospital and they need a safe place to sleep, they need respite, and they're willing to work with our team, they can stay in a Bob bungalow. We also have a patient overnight parking program at one of our rural hospitals. If folks are living in their car and they maybe need a safe place to sleep, they can sleep in our parking lot as long as they agree to work with our team. It's not ideal, but it is something. And I will say that program has only had about a dozen participants up to this point, but we've been able to help house all of them. So that's 12 people off the street, right? 12 families, 12 couples. So these are some of the things that we're working on. We also have a motel shelter program. We got some grant funding to have dedicated motel rooms for folks that, again, need respite. And they need respite from living outside. Doesn't necessarily mean they need medical respite, but as anyone can imagine, it is challenging living outside. Some of the things I wanted to point out about the Bob program that makes us unique is, obviously, as you've heard, we are trying to come up with innovative solutions to many different issues in our communities. And for me, what that really means is becoming a change agent. So each person on the Bob team, each Bob team member in their own right is a change agent. They're advocating for tiny house, tiny home partnerships. They're advocating for patient overnight parking programs. They're advocating for all sorts of things that might not be the norm for the healthcare system, but we're fortunate enough to be able to help solve these things for our community. And I will say, I put on here understanding trauma. And I put that because not only is it important for me that our team is providing trauma-informed care, but that we're also each recognizing our own traumas, right? So we all come to the table with different traumas. And folks, again, on the team that maybe have been living outside or have struggled with mental health issues or substance use issues, it's really important to me that as a leader, we foster wellness in the team. And so that is something that is really, I like to pride myself on creating a really trauma-informed culture for the team. And honoring stories. I mean, the reason I shared Angela's story today was because she had a huge impact on me. And as I mentioned in the beginning, when I shared her story, everything I do in the Bob program is not only with the team in mind, but Angela and all the Angelas I've worked with over the years. I will never forget her. I will never forget that impact on me. And I feel honored that she shared her story with me, that she felt safe enough to share her story with me. And so I really hold that dear. And redefining success. Again, yes, we have metrics, like I mentioned. We've been able to reduce ED utilization for folks. I mentioned the hospital days saved. But what does success look like for folks, right? Maybe success, like thinking of Angela's story, she didn't have to die outside. She was able to die with dignity. She got to see her son and grandson before she passed away. Some of the biggest regrets she had, like I mentioned, were not having a relationship with her own children and feeling like she was a terrible mother. But I like to think that when her son and grandson came to see her before she passed away, that maybe she was able to close that loop a little bit. So with all of this, I know that the power of relationships is huge. And that is what the Bob program is built on, and the power of community. As I've mentioned, we have some creative community partnerships, and I really value those, and I look forward to creating more in the future. So here's some photos of our team all over. I put the one up on the top left to show that our team does like to share their stories. I love for them to be able to share their successes and maybe their struggles of why they're doing this work, and what drives them to help others. On the 3 photos on the right are us co-locating our program services with other community partners. Ones that I mentioned, the shower cart, so it's a photo of a shower cart, and also a laundry event. And then the bottom left, that's some of our team when we had the really bad wildfires in Clackamas County. We partnered up with county folks to help evacuate people living in the woods. It was a really dire situation, and really quickly folks were having to evacuate because of the density of the smoke, and we had no way of getting word to folks that they needed to actually evacuate. So we were able to get a group together of the Bob team and partner with some other community partnerships in the area and go help folks evacuate their belongings. And again, the power of relationship. So these 2 photos are of our team doing outreach events in different communities. Again, where we are bringing food and supplies to folks in need. As you can see, we have one of our Bob team members playing with someone's puppy in the photo on the left. But these events are great services to our community, but they're also great events for our team. This is a way for us, as we continue to grow and spread out across the state, for us to get together and to really value each other and get to know one another. It's really important to me that we create that culture within the team. I wanted to mention a little bit about our work in 2021. We want to continue this work and we want to continue expanding. But the fact is that we do rely on philanthropy and grants to continue this program. And last year, we estimated we served around 8,600 people through all the different programs that I mentioned, the follow-up calls, the emergency department outreach, our outreach events, our, food co-location events. And we know this number, some folks, there might be some duplication, and maybe we provided a follow-up call for somebody and then also did emergency department outreach. But honestly, I really feel like this number is probably lower. It's probably a low estimate. And I wanted to point out, I focused a lot on talking about social determinants of health, and I wanted to make sure that everyone knew that we are screening every person for that. So every person that gets referred to Bob that we start working with, we're screening them for social determinants of health needs. And we're asking folks to really guide their care and let us know, what is the priority for you? What do you want to be connected to, right? Is it housing? Is housing the number one priority? People often come to us with a multitude of things they want to work on. So it's almost like peeling back layers of the onion, right? And so it's hard to pick just one. So we try to tell folks, just tell us one, we'll just start with one and then we'll go from there. And so that is really, really important to us. And as I finish, I wanted to share a quote from Brene Brown about connection and the power of connection, because I feel like I've spent this time really overemphasizing relationship. So Brene Brown says, connection is the energy that exists between people when they feel seen, heard, and valued. And for me, I want to add that I never want anyone to feel unseen, unheard, and unvalued. Thank you so much.
Thank you, Becky. And I want to remind folks that we are using the Q&A feature for questions, and we are tracking that. So we have a question already that we'll direct to Becky, but please do use that. If you have questions, we have plenty of time for questions. And so I think that's a real gift of this time, that you can ask Becky, who has this wealth of experience. So I'll start with the question that we have first, which is that someone spotted Seaside in one of our photos, and that's wonderful. But we wondered, where is Bob available? I know it's a big piece of our acute care hospital care, but I'd like to know all the different ways that Bob interacts in our Providence settings.
Yeah, so the Bob program, as folks may or may not know, we have 8 hospitals in Oregon, from Hood River to Medford, Seaside, Newburgh area, and the metro area. So the Bob program currently serves all the hospitals to some degree. So we are in person at every hospital except for Hood River, which we are getting ready to hire for as we speak. But we are providing the caring contacts follow-up calls for Hood River Hospital at this time.
That's great. And I would like to talk about the peer support program for just a minute. I know it's a really effective model, somewhat unique. And so could you talk a little bit about how you recruit and train these peer specialists? And also, I'd like to know a little bit more, Becky. I know it's a very sustainable model, dependent upon grants and philanthropy, as you said, but very sustainable, like business smart, I guess I would say. And maybe you could talk about a little bit why that is, because it's really been an easy model for us to adopt.
Mm-hmm. Yeah, so luckily we have a huge network of folks that we work with in all the communities we serve. As you know, we are everywhere, and it often feels like we know everyone. I get messages all the time. I get calls all the time. Folks want to join the Bob team. And I will say we actually have a former client who is in a peer support training as we speak, and I would love to have him on the team. So we recruit everywhere. It's really through our networks. I mean, we advertise the positions through our Providence Jobs website, but often we know folks in the community that want to be a part of the team. And so we're lucky to be able to recruit folks that already have experience doing this great work. And as far as the business model, well, I mentioned to everyone some of the successes. And as you can imagine, like I said already, during these times with COVID, reducing unnecessary emergency department utilization, opening up hospital beds during this time where, we are overloaded with patients with COVID, right? That's invaluable. And we are lucky. Some of our programs are funded through our regional budget, but others are dependent on grants.
Thanks for that. I appreciate that. So we had a question just about how, I know this is really complex because you interact and have interactions with a number of folks who are houseless in our community. And is it sort of a repetitive kind of thing? Do you see people come in and out of your care like numerous times, or do you see them permanently moving out of houselessness? Is there a sense that you have about the people that you serve, and maybe even what the stats are around a concept like that?
Yeah, I will say I should preface, so the emergency department utilization the data that we get around reduction, right, is we look at 12 months prior to somebody intervening with the BOP program. So I met Angela, we're going to look at her data for ED utilization for a full 12 months if we can, at all hospitals. And I will say this is at all hospitals, not just Providence. We look at that data for 12 months prior to me meeting with her. Then we look at data for all hospitals for utilization 12 months after, right? And so we're trying to really look at a long picture of, is somebody just not coming into the hospital immediately because they're getting their needs met because I'm working with them, or are we looking at this long term, right? And so we're still seeing consistently about a 45% ED reduction for even 12 months after. As far as folks, coming in and out of homelessness and working with our team, I mean, there are times, yes, we do have folks that we, open their case, close their case, and it comes around again. But I would have to say more often than not, that's not the case, right? And, we're really, really lucky. Again, I'll mention our community partnerships is we can pass off care to somebody, to one of our community partners. We trust all of these folks, right? They all do amazing work. And so they're able to sort of pick up where we left off, right? And help that person like further down the road. There are a lot of programs coming up in different communities around that longer term care. We know folks that have been chronically homeless. Just because you put them in an apartment doesn't solve everything, right? Folks need support. And so, the community is learning that we need to be able to offer more support to folks long term.
Thanks. I really do appreciate I think the partnership piece of this is so important. And I will say that we at the foundations we're working on a grant, and we said, well, the BOB program would be involved. Oh, well, you should have said that at the beginning, because the trust factor about partnering with this particular community organization was very high because of the reputation that BOB has. So that's a wonderful reflection on the program. So if you talk about partnerships and you have, partnerships for things like showers and that sort of thing, but you identify a service that really needs to be done, or there's a lack of, how do you handle that? I haven't gotten the impression that Bob, creates these kinds of things, but really looks to partnerships. So could you talk about how you engender that and, try to fill the gaps with partners?
Yeah. So being in all the various communities that we're in now, I have had the pleasure of working with lots of different leadership at the different hospitals Bob is at. as well as community partners. And so the more I interact with folks and the more our team immerses themselves in each community, I hear what the needs are, right? Or I hear ideas, we really need to do this. And that's where, the light bulb sparks in my head. Can we partner on this? Because the idea is to really fill in the gaps. I mean, like I've mentioned a couple of times, we know we're not solving homelessness. We know we're not solving hunger. We're not solving we're trying to do our part. And a lot of that is finding opportunities or creating opportunities with others to fill in some of those gaps wherever we can.
Yeah. And so there must be some folks that you help that aren't necessarily houseless. Do you find that that's a high percentage of your overall interactions or contacts with folks? Or, I mean, do you have a sense of that? How many folks you might be touching that really aren't houseless, but are the working poor, living in another situation, something like that?
Yeah, it depends on the area, right? So Portland metro area, our outreach specialist is seeing probably 90% of our caseload are houseless. In other areas where maybe we don't have as many homeless folks, that number's lower. So it really just depends. And sometimes, it cycles through. We get referrals from not only our hospital systems and clinics, all the programs we work out of, psychiatric units, but we also get them from the community. We get them from the fire department, EMS, police, all sorts of different community partners. And so it just really seems to ebb and flow, like whatever's happening in the community at that time. If the camp just recently got swept, then we might get an influx of referrals for folks living outside.
That's great. That's interesting to know. Well, I know I had a question, and we'll talk a little bit in a moment about how people can help, but I've actually worked individually with you as a community member, as has my church. So I wanted to throw this idea out, maybe even get some clarification. So our church did some little packets that we wanted to give to homeless, and it was not as easy to distribute them as we thought. We had lots of luck putting them together and donations and that sort of thing. So I called you and you came and got those. And we've actually had a continuing relationship around that, which has been wonderful because we really trust you to give these to folks who need them and more about approaching various communities and all of that sort of stuff. So that's been a great partnership. And if people wanted to make outright donations of things like that, like little packets or items that they have, I know that's work for you to collect them, because I remember you came to my house and collected them. So I thought that was really working with your heart. But I also wanted to know, is that something that you invite or you do on an opportunistic basis, or how might we partner if we wanted to donate things for folks?
Yes, we love donations. I am actually working with the foundation at Willamette Falls to create an Amazon wish list. And it's kind of been a work in progress. We want to make sure that we're really mindful and intentional about what we put on there. So that should be published soon on their foundation's website.
Oh, good. All right. So Willamette Falls,
Mhm.
you can Google that, Willamette Falls Foundation. And if we're together with this, we'll put this in the chat so you can have easy access to that. But it sounds like, Becky, you're open to partnering with entities like churches that are wanting to do something for community and have donations and encourage their congregation members to be active in the community. Yeah, that's wonderful. Well, I believe that we have addressed all the questions that have arisen in the Q&A, but I am happy to entertain more. We have a little bit of time. So if you have a pressing question, please let us know, and we will share that. And thanks to our facilitator, Hallie, for putting information in about Willamette Falls. Thank you for that. I'll just pause for just a minute. If there are additional questions, we invite them and encourage them. And then I'll just let you know a couple things about upcoming events and ways to engage with Providence. First of all, thank you so much, Becky. Your time is valuable and treasured, and we really appreciate that you took this time to be with us today and to answer our questions and to be just so transparent about all that you're doing in the community and for Providence. We really appreciate it. So
Thank you for having me.
no problem. If you were inspired by today's presentation and you would like to get involved and learn how you can help, please feel free to connect with our team. I'm happy to facilitate any kind of connection you want to make. And my information is on the screen. We will also be sending a follow-up email in the coming weeks. We also thought you might be interested in knowing that the Providence Bridge Pedal is coming up very soon, and the Bob program is this year's Bridge Pedal and Stride beneficiary, and a portion of the registration will benefit the Bob program. So that's a wonderful way to be engaged if you haven't done this before. I did the Providence Stride a couple of years ago, and it was fascinating to be on the bridges and looking down and just seeing our beautiful city in from a different perspective. Wonderful to not be in a car and be on a bridge. So I encourage you to register if you'd like. We really would. I think the link should be in the chat, I believe. And I wanted to let you know that today's talk is part of our 2022 Providence Doc Talk virtual speaker series. So it's very accessible virtually. In our next talk on Wednesday, September 7th, we will hear from Dr. Seth Oliveira on the topic of restoring function with minimally invasive brain surgery to treat movement disorders, epilepsy, tumors, and more. You can register and get information at providencefoundations.org/doctalks. Thanks again for joining us today, for asking questions, and thanks especially to Becky for joining us with her heart and her great mind for this work.
Thank you. I would like to say something about the bridge pedal. I would love for anyone that plans to be out there to stop by the Bob booth. We actually will have a necessity pack building event. So we have lots of donated supplies that we will be setting up on tables for folks to come and put things together to either give to our team to give out, or if you are living near someone that's living outside, feel free to take packs and give them out yourself. So it's going to be a lot of fun. You'll also be able to meet some of the team. We'll have about 6 folks from the team on there.
Wonderful. And the registration link is in the chat. So if you want to access that and register, we would appreciate the support. And it's a really wonderful way to see our city. So thank you again, Becky, and thanks to you for joining us today. We really appreciate the opportunity to share this invaluable information with you.